Hi, I'm Louise Parker. I'm the founder of the Raynaud Clinic.
And I'm Kevin Howell. I'm a clinical scientist in microvascular measurement. And today we're talking about Raynaud's phenomenon. Louise, can you tell us a little bit about what Raynaud's phenomenon actually is?
So Raynaud's phenomenon is relatively prevalent in the population. It's an episodic circulatory condition affecting the hands and feet. And that essentially means blood flow is reduced to your fingers and toes in response to cold, temperature change, and sometimes stress. This can manifest itself with colour changes to the fingers, numbness, discomfort, difficulty with grip. Triggers can vary from person to person, along with the severity and frequency of symptoms. Raynaud's can be primary, which means it's without an underlying associated condition, or can be secondary to other diseases, which is the more serious form, and that's why it's important to get a diagnosis early to ascertain if a patient has primary or secondary form of Raynaud's.
And what would a patient referred to you expect to happen at a consultation with you, Louise?
So we have a really thorough consultation. I'll ask you all about your symptoms, triggers, the history of the condition as you've experienced it. We'll talk things about past medical history, any medication you might be on, your lifestyle, and we can discuss practical approaches to managing symptoms of Raynaud's, potential treatments to help support you with living with the condition.
So Raynaud's phenomenon is more commonly an isolated condition, right? It's a primary disorder. What conditions might Raynaud's phenomenon, on the other hand, be secondary to?
So they may be secondary to conditions such as scleroderma and lupus and some other rheumatic conditions. These are rare complications, but it is important to investigate the possibility of so the patient can be managed appropriately.
And Louise, what investigations might be necessary as part of your consultation, and why?
So part of a full investigation may require some specific blood tests as well. We also perform thermal imaging, which is cooling of the hands, and a Nailfold capillaroscopy, all on the day of your consultation. I'll ask Kevin now to perhaps explain these in a bit more detail.
Thanks, Louise. Yes, that's where I come in, of course. So Nailfold capillaroscopy is a simple and painless investigation which uses a handheld microscope to photograph the capillary blood vessels in the skin adjacent to the fingernails. If those Nailfold capillaries that we photograph appear normal, it means that a patient with Raynaud's phenomenon is highly unlikely to develop an associated condition, in particular of the scleroderma type. But where the capillaries show changes, we're able to monitor more closely in association with other investigations so that patients can be treated promptly if necessary. And then the thermal imaging we perform allows us to assess the sensitivity of the hands to cold. We perform a gentle cooling of the hands in water and then evaluate how quickly they rewarm with a thermal imaging camera. This helps Louise in assessing the likely severity of the Raynaud's phenomenon, and she can tailor her advice to patients as appropriate. So Louise, in your experience, what do patients comment on most regarding their struggles of living with Raynaud's phenomenon?
Yeah, it is the day-to-day things that obviously cause most frustration. So patients often complain about things like air conditioning being very cold, that can often precipitate what we call attacks of Raynaud's starting in their hands or feet. So going into the supermarket, sometimes restaurants, shopping centres, doing your gardening, or even people commenting on how cold your hands are, or seeing the colour changes that start happening. A lot of people also who do outdoor sports or sports in the winter also struggle to hold things and perform what they'd like to do with some difficulty, particularly if they're outside for prolonged periods of time. And any exercise, for some people it can make it better, for some people it can make it worse. So we can talk through all those things and about how to manage those things a bit better. And patients also often say to me that stress and emotion or anxiety or stressful situations can also precipitate attacks. We do have more information on our website as well, on the Raynaud Clinic website, so you can look at that for more Q&As on there. And we do also offer not only a one-stop clinic for new patients where you'll see myself and Kevin for tests, but you can also see me in my follow-up clinic as well, so patients don't feel that they are left alone after their first appointment. You can continue to be supported.